Hello everyone, welcome to SCALP Acupuncture Part 16, presented by Lamp AcuWellness Foundation Inc. Our topics for this episode include techniques like three-edged needle therapy, intradermal needle therapy, cutaneous needle therapy, Moxibustion, and magnet therapy. A three-edged needle is used for shallow stimulation of the scalp points to treat acute conditions. It will release a small amount of blood. Bloodletting functions to invigorate blood, clear heat, sedate fire, and calm the Shen. Hold the three-edged needle on the surface of the area that is going to be bled or has superficial vessels. Quickly poke into the skin about 0.5 to 1 fin to cause bleeding. Let the blood flow for a short time or until blood changes from dark red to bright red, and then apply pressure to the puncture area with a sterile cotton ball to stop the bleeding. Use the three-edged needle to treat points on the forehead, vertex, and temporal area. Normally, do not use three-edged needles on the occipital area. The three-edged needle is used for acute headaches, eye or ear infection, coma from stroke, or convulsions with high fever. With three-edged needle therapy, you should use caution not to insert the needle too deeply and should follow clean needle technique to avoid infection. For patients who have a disease causing thin blood and a tendency to bleed, do not use the three-edged needle. People who are weak, pregnant, or elderly require caution when using this method. Normally, use the three-edged needle to treat once every other day with 1 to 3 treatments per course and get 3 to 5 drops of blood on each point at the time of the treatment. Intradermal needle therapy was developed for conditions where the patient needed to retain the needles for longer than 1 day. 2 types of intradermal needles are used: thumbtack needles and grain-like needles. Use routine clean needle technique on the scalp before inserting the needle. Insert the grain-like needles along the scalp and then affix with adhesive tape over the needle. When inserting thumbtack needles, the practitioner should tighten the skin with the left hand and insert with the right hand using a vertical insertion and apply adhesive tape to affix the needle. For the intradermal needle therapy, it is critical to follow clean needle technique. In the meantime, check all the needle tips for quality and cleanliness. Be concerned about the convenience of the point for the patient when he sleeps. For example, the temple and occipital areas usually do not use intradermal therapy. In the summertime, the intradermal needle should only be retained up to 3 days. Limit 1 to 3 needles for each treatment. Due to intradermal needles becoming easily lost in the hair and hair growth, they are not commonly used on the scalp. Cutaneous needle therapy is also called plum blossom needle therapy. Stimulate the surface of the scalp until petechiae form, but do not allow bloodletting. Cutaneous needle therapy functions to invigorate blood, clear heat, sedate fire, and calm the Shen. The area must first be sterilized with alcohol. Hold the distal part of the handle with the index finger on the anterior part of the handle. Hold the cutaneous needle about 3 to 5 centimeters above the surface of the skin. Rapidly tap on the prescribed area of the skin with a light, flexible movement of the wrist. There are 3 types of tapping. Mild tapping. Tap mildly on the skin until the skin becomes slightly red with very mild pain. Use for deficient patients, elderly, children, or patients with long-term illness. Moderate tapping. Tap lightly until the skin becomes slightly red and the patient experiences some mild pain. The local area of the skin will be red, with small pimples but without bleeding. Used for average patients. Strong tapping. Heavy tapping until the skin becomes red and moist with slight bleeding and pain. The patient will have obvious pain that is tolerable. Use strong tapping for excess conditions and new diseases. To be used on patients with a strong constitution or patients with a slow sensory reaction. Use cutaneous needle therapy to treat the patient once every other day with 10 to 15 treatments per course and 2 to 3 weeks between courses. Cutaneous needle therapy is commonly used on the forehead, vertex, temporal, and occipital areas. For important points, tap repeatedly with strong stimulation and use in combination with face, neck, back, and sacral area body points. Cutaneous needle therapy is used for patients with dizziness, headaches, alopecia, insomnia, tinnitus, chronic eye diseases, nosebleeds, hysteria, and stroke. Moxibustion therapy uses MOXA cones or MOXA rolls to warm the surface of the scalp in order to move qi and blood to prevent and treat disease. The MOXA roll technique. This technique uses warming Moxibustion, rotation Moxibustion, and Moxibustion along the area and zone on the scalp. With scalp acupuncture, most points are distributed on a line or zone, so MOXA rolls are to be used along the treatment zone from up to down or from the back to the front of the scalp. In performing warming Moxibustion, the emphasis is on the starting zone or ending zone area. Each point will be warmed along the zone, up to down and back and front for 5 to 7 minutes. The MOXA roll is held 5 fen to 1 sun above the skin. MOXA cones can also be used with scalp acupuncture to treat conditions. Use direct MOXA and indirect MOXA. Moxibustion with scalp acupuncture therapy is used for patients with headaches, dizziness, stroke, insomnia, seizures, hair loss, anal prolapse, eye conditions, and sequelae of disease after injury. Use a MOXA roll once daily and a MOXA cone to treat once every other day with 3 to 7 days per course and 5 to 7 days of rest between each course. Herbal injection therapy is the injection of herbs into an acupuncture point. The combined stimulation of the point with herbs and acupuncture can adjust the body's function and change the pathology to treat disease. Depending on the disease, anything that can be injected into the muscle can be injected into the scalp. The most common herbs used for injection are hangwa, tension, and vitamins B1 and B12. Use routine clean needle technique to clean the surface of the skin. Insert the needle into the point until the patient feels soreness and a distending sensation. Withdraw slightly to see if any blood appears. If no blood appears, start pushing the herb into the scalp. On the scalp points, push the herbs in very slowly. The angle of the needle should be oblique or transverse. Usually, the needle tip is 5 fen deep. In each point, inject 0.25 to 0.5 milliliter and choose 3 to 5 points. Treat every other day with 7 to 10 treatments per course and 3 to 5 days between courses. Herbal injection therapy is used for headache, high blood pressure, dizziness, hysteria, maldevelopment of the brain, and sequelae of brain injury. Herbal injection therapy should be used with caution in the following conditions. Use substances that are within the correct scope of practice. Follow clean needle techniques. Select the correct substance dosage. Avoid overdosing. Select the correct combination of substances. Perform allergy tests if necessary. Use proper direction and depth on the scalp. Use with caution in elderly patients, pregnant patients, weak patients, and new patients. Magnet therapy uses a magnetic plate on the surface of the point or around the meridians to treat disease. Methods used in scalp acupuncture use a magnet touching the surface of the scalp, a magnet combined with the needles, or electricity. Using small magnetic balls or a plate, apply the magnet to the surface of the scalp and cover with tape. Choose a magnet 3 millimeters thick and leave it on the surface for 5 to 10 days. Change magnets for 12 treatments per course. Magnets can also be used with a hat. The patient should have the magnet touch to 20 pai hui. The hat magnet is used for 10 to 12 hours per day for 1 to 2 months per course. This technique is mostly used for patients who have high blood pressure and headaches. Also, the magnet can be combined with needles. The magnet may be applied over embedded intradermal needles. The needles with the magnets are used for patients with high blood pressure, headaches, stroke, sequelae of brain injury, and seizures. Use a small magnet in the beginning of the treatment. If there is no obvious result and no side effects, gradually increase magnet strength and treatment length. Magnet treatment is relatively safe. Some patients may experience dizziness, low energy, palpitation, nausea, and vomiting. Side effects can include a decrease in blood pressure, or local skin areas can become itchy, burning, and painful. However, side effects only happen in a very small percentage of cases. Thank you very much for your attention. See you on our next videos.